The purpose of this podcast is simple. We want you to get to know your doctor before meeting them in person, because you're making a life-changing decision and time is scarce. The more you can learn about who your doctor is before you meet them, the better that first meeting will be. There's no substitute for an in-person appointment, but we hope this comes close. I'm your host, Eva Shea, and you're listening to Meet the Doctor. Welcome to Meet the Doctor. My guest this afternoon is Martin Ajujo, and he is from Nairobi, Kenya. And I believe you're the first person from Kenya that I've ever had on the podcast.
It's my pleasure to be here.
So you are a plastic surgeon, and let's maybe go in reverse. And why don't you start with how did you end up here in the United States?
I came here for the meeting, the plastic surgery conference at Austin. Before that, I'm a member of Share Global Fellowship. The year 2023-2024. I'll be graduating that class next year. But my training is in the University of Nairobi, both for undergraduate and postgraduate in Kenya.
So are you still training right now, or are you practicing?
I'm practicing. I finished my postgraduate in 2019, and I'm now working as a private practice and a public practice. I'm doing for the state, for the county government of Nairobi. And also I have my own center for cosmetic practice, AJ Plastic Surgery Center.
And how is it plastic surgery different in Kenya than from the United States?
The practice is picking up, especially for cosmetic procedures, for breast and body procedures, a number of facial procedures. However, there's a huge demand for cosmetic procedures, aesthetic procedures. And I do about 30 to 40 procedures a month, purely cosmetic. And right now, the last 2 years or so, my practice has been more of aesthetic procedures, let's say 60-40 compared to reconstructive procedures.
And do they find you on the internet or?
Yeah, social media has a lot of influence and reach in Kenya with good internet penetration and mobile. So a good number of my patients come from Instagram, and some of them, they just Google through my website. Some of them find me through just referral, word of mouth for my colleagues.
How many plastic surgeons are there in Nairobi?
The total number of plastic surgeons in Kenya, we are, I think, 20, approaching 30. Nairobi has 60% of that number, and then a few scattered in different cities in Kenya.
And are you all friends with each other?
Yeah, we were good friends. However, in that number, we can say only 30% of the plastic surgeons do aesthetic procedures. So we're like 4 or 5 surgeons who do aesthetics. Yes.
What procedures are most popular? Is it really similar to the United States, or do you think that it's slightly different? And I'm curious if there's a reason why, if it is different.
It is slightly different. For example, here for breast procedure, number 1 is augmentation. For our population is reduction. So yeah, I do more of breast reduction procedures than augmentation.
That is interesting. And is breast reduction purely cosmetic procedure, or does insurance? Do you have an insurance system like we do in the United States? Yeah.
We have almost similar third pair arrangement with America. There's a huge fight and a huge advocacy for insurance company to cover breast reduction procedure.
But they don't right now.
They don't. It's case by case basis. You really have to justify it being a medical procedure. However, at least in the last 6 months or so, 1 year, I can say I've done a number of patients paid by insurance for breast reduction.
Oh, that's promising.
Yes. The sad thing is that our patients present very late when they really are symptomatic. And we do massive reductions. I think the largest I've done is 16 kilograms. Don't know how much that would be in pounds. Quick math.
Yeah, no, I would have to Google that. I would ask Siri.
Yeah, but my average reduction is above 5 kilograms. You see, that is high. And normally the worldwide average is below 2 kilograms. So you can see we're doing double. Because they present late.
That makes me wonder, are their breasts actually growing over a long period of time to the point where then they become so miserable that,
Yes,
yeah.
that's the sad part of it. Yeah, that's the sad part of it.
Is that a medical condition?
It is. It is a medical condition, but most insurers will push it to be a cosmetic procedures. And unfortunately, yeah. So it's a fight. That's why for us, we do more of breast reduction procedures as opposed to augmentation.
That makes sense.
So for body procedure, there's a very, very huge offtake and inquiry about liposuction, lipo 360, and BBLs. It's a big deal. And of course, body contouring procedures, tummy+tuck being included, and the mommy makeovers. So almost you can say a ratio of 1:30, 40%. We are doing body procedures. That's the body contouring, tummy+tuck, mommy makeover, and a small number of patients body contouring after massive weight loss, because there's a huge shift towards weight loss and rapid weight loss procedures with balloons or gastric sleeves.
Oh,
Yes,
yeah.
yes.
When people come to see you for the first time, what can they expect from that appointment?
I usually say the first appointment is just knowing your patient and setting up what are your aesthetic goals. And really have to know that I have to try and give you what I can help to achieve what you want. If I can, then I'll have to let you know this is how far we can go. Then once you set the goals, then I screen you to see if you're fit for procedure. Then if you're fit for procedure, then I set up most of the time a second consultation so that we go over again about if I needed to do a lab test or imaging. We review the imaging, we review your aesthetic goals, then we do your booking. Yeah.
Who else is on your team that someone might meet while they're there to see you?
Yeah, I have two doctors, junior doctors who assist me, and a wonderful team of nurses that I work with. But if you don't find me in the first consultation, you either find my two assistants.
And then do you have a staff around the three of you, or is it just the doctors?
Now we have doctors, then we have nurses, we have theater technicians, have anesthesiologists, farm techs. It's a huge team, a team of about 15 in the clinic. Yeah.
Is there someone who your patients, like a patient coordinator or someone who holds their hand, takes care of them, makes sure that they have everything they need?
Yes, you do. I have the customer service team. I have 3 members in that team. 2 of them will be physically be in the office, but one of them runs the virtual, the WhatsApp, the Instagram, DMs. So I have that team.
Yeah.
3 of 3.
Yeah. They end up being your patients' best friends for a while.
In fact, when my patients come, they ask, I want to meet so and so before they even meet me. And they're very wonderful. I'm very, very grateful to have such a team with me.
Did you grow up in Kenya?
Yes. Born and bred in Kenya.
And then when did you decide that you were going to become a doctor?
I think I was torn between being a doctor and a pilot. And at some point, being a fighter pilot. Yeah. And then that's when I went to high school. I did a bit of aviation. Then I say it's not my thing. Then when I joined med school, I knew I wanted to use my hands, but I didn't know where really I'd do that. Then the first year when I did the first cadaveric dissection, then it just hit me that I have to be a surgeon. But even then, I didn't know about plastic surgery. I didn't know how to be a plastic surgeon. Actually, until during my internship, because I went to a military hospital, and that time we had the Kenya had invaded Somalia, so we had a lot of casualties from that war. And I was taking care of the soldiers who were injured. Some plastic surgeons were called in to do reconstructive work, and then that's when I said, "This is what I want to do." Yeah.
Do you remember any patients in particular that you saw or met at that time that?
Yeah. I remember a young man who was a victim of an explosive IED. So he had severe injuries, fractures, burns. So when you combine fractures and burns, and I remember I had to take him to theater almost every day to do change of dressings, just to prepare the wound bed for reconstruction. He had also injury along the pelvic area. So we had to do penile reconstruction. We had to do huge flaps. I think that patient, and there's another patient that had a huge defect on the leg of soft gunshot wound. And then we were in theater for about 6 or 7 hours. We did a flap. And then at the last minute, it advanced. We had to move and take another flap. So all that really, I can say, prepared me for what plastic surgery entails and how you have really to be on your feet and really have to change from plan A to plan B, plan C quickly. And I thought that's what I'd want to do for the rest of my life.
And do you still, to this day, have a plan A, plan B, plan C for every patient?
Definitely.
Yeah.
Definitely. You cannot, I don't think any plastic surgeon will survive going to theater without plan A, B, C, and D. Yeah, because things change.
What do you like to do when you're not at work? Are you a fighter pilot in your free time?
Funny thing, I don't like flying.
Good thing you picked surgery.
Just telling you, it was a long flight from Nairobi to Texas. So,
Did you fly to Houston first?
no, actually,
Or
I went
Dallas?
to Dallas.
Yeah.
I don't like flying, but I like listening to music, like traveling. So that's why I have to say, a week just to travel and meet new people and read. Yes.
What are you reading right now?
Ikigai. Ikigai is a Japanese book.
If someone's listening to this podcast and wants to find out more about you, where should they go online?
I'm on across all platforms. Like on AJ Plastic Surgery. That is on Instagram. Website ajplasticsurgery.co.ke. Also on TikTok, AJ Plastic Surgery Center. Twitter, AJPSC. That is AJ Plastic Surgery Center -official.
Official.
Yeah. We on
Somebody copying you?
Yes.
Oh, no. That's the worst. Well, is Twitter more important in Kenya than it is here for plastic surgery? It's terrible here.
Yeah, okay. Let me just say this. I hope Elon Musk is not listening, but there are more bullies on Twitter than fans. So for plastic surgery, really, it's not useful. Instagram is, because we're able to compare, see before and afters.
Yeah.
Yeah.
Twitter never really took off for patients to find surgeons. And surgeons, you have to have a lot of time to be on Twitter and do it well. So it just doesn't work.
Yep.
Yeah. But I know a lot of doctors connect with each other on Twitter, and that does work.
Yes. And also LinkedIn, especially professional connection is good for professional connection. However, for patients, I find Instagram to be more useful. Yeah.
Definitely. Well, I'll make sure we put all those links in the description of this podcast so they're easy to find.
Thank you.
And thank you for sharing yourself with us today. It was a pleasure to meet you.
You too.
If you're considering making an appointment or are on your way to meet this doctor, be sure to let them know you heard them on the Meet the Doctor podcast. Check the show notes for links, including the doctor's website and Instagram, to learn more. Are you a doctor or do you know a doctor who'd like to be on the Meet the Doctor podcast? Book your free recording session at meetthedoctorpodcast.com. Meet the Doctor is made with love in Austin, Texas, and is a production of The Axis, THEAXIS.io.